Swati Negi. I'm a GP partner at the Cottons Medical Centre, and I'm also the frailty lead for the PCN. When we first started having meetings with Dr. Bo, I remember, and it might have been Phil who told me, well, it will reduce GP workload. And I said, if I had £1 for every time I was told that, I would be a very rich person. As a GP, I didn't actually believe this is something that might benefit primary care. And the main reason is this was an external service, and it felt like there might be more put on to primary care. In terms of our care home, it has worked a lot better than I anticipated. So our care home used to call us with maybe 6 visits requests a day. Some of them did not need a GP visit, some of them were just medication queries. As a result, because of the sheer volume of visit requests, sometimes there was a risk with the clinicians being really busy that the care home staff may not have noticed an unwell patient. But with the Dr. Bo questionnaire and the virtual hub, as long as the nursing home has recognized the patient is unwell or deteriorating, we know there is somebody that they can contact, even if they haven't contacted the GP practice, and therefore patients are much safer. It has worked and reduced our workload. We very rarely get any visit requests or calls during the week from the particular care home that has adopted it. Most of the queries are left for the Monday ward round. But they still recognize the unwell patient, and therefore we will get those acutely unwell patients, and therefore being able to tackle them rather than getting overwhelmed by the number of requests that were coming through on a daily basis. We are in the process of aligning Dr. Bo with System 1, and then we should be able to see the historical data that Dr. Bo have over our patients. Dr. Bo do a monthly wellness check on patients, and therefore they have built up this history of patients' normal weight, normal observations, saturations, blood pressure levels. So if the patient presents as being unwell, or the care home brings us and tells us we are not sure about this resident, that they're not particularly well, but we can't put a finger on it, we might get some information based on any of the new data that's been uploaded, whether their blood pressure is low, whether their oxygen saturations are not normal for them. So this historical data will help us make some clinical decisions. It is about having faith in the system. I can only say by what it feels like on the ground. So in the GP practice, we have noticed a reduction in the number of calls from our care homes. We have also noticed early interventions, so people have called up and said, we have been advised by the virtual hub to discuss this with the GP. The system is responsive, and if the GP practice works closely with the virtual hub team and the care home, they can make it work for their practice and their care home.